Somewhere in the last few years, something shifted. Women in their 30s and 40s are now talking about bones. Not just vague mentions of exercise. We're discussing weighted vests, deadlifts, and protein intake. Google searches for bone density skyrocketed in 2024. It's as common in mom chats as drop-off schedules. But this frenzy is a mix of science and wellness noise. Let's separate the important from the irrelevant. Bone density is a real issue for women in midlife. Women reach peak bone mass between ages 25 and 30. Then, the body's natural remodeling process starts to change. Osteoclasts, the cells erasing old bone, start outpacing osteoblasts, the builders. This is normal, it happens to everyone. Yet for women, menopause accelerates this process. Estrogen helps regulate osteoclast activity. When estrogen levels drop, bone breakdown picks up speed. Women can lose up to 10% of their bone mass during menopause. In the US, 1 in 5 women over 50 has osteoporosis. Many more have osteopenia, which increases fracture risks. It's a silent disease, says an orthopedic specialist. Symptoms often appear only after fractures occur. This silence is why awareness is increasing. Women are paying more attention than previous generations did. However, the conversation can get overwhelming. Wellness trends turn bone health into a part-time job. Lift heavy, no, just walk. You need creatine. This intensity makes women feel guilty if they do less. The problem? Much advice lacks real clinical evidence. Exercise does help maintain bone density, but here's the nuance. A 2025 review confirms that resistance training works best. Combining aerobic and resistance training shows even greater benefits. However, benefits are moderate and specific. You must start early, ideally before significant loss occurs. Simply put, not all exercises are equally effective. Weight-bearing activities strengthen bone, swimming does not. You don't need to lift exceptionally heavy weights. A 2024 meta-analysis found that exercise helps but should fit your profile. Start with something manageable even with lighter weights. Now, let's talk about the popular interventions. Weighted vests sound good but require a long commitment. Most studies agree that extended wear is necessary for benefit. For active women, they may help slightly, but for many, effects are minimal. Next up, whole body vibration platforms. These have gained traction among women who dislike lifting. 2025 research indicates they can show some benefits. But their effectiveness varies widely by machine and user. The science isn't as straightforward as marketing suggests. What about nutrition? Yes, protein matters. Bone is 1/3 collagen, which is protein. Low protein leads to lower bone density risks. The recommendation for adults is at least 0.8 grams per kilogram. Older women may benefit from between 1.0 to 1.2 grams. That's about 65 to 75 grams daily for a 140-pound woman. It's achievable without excessive yogurt. Calcium and vitamin D are crucial too. Adults under 50 need about 1,000 milligrams of calcium daily. Women over 50 require about 1,200 milligrams. Vitamin D helps absorb all the calcium you consume. There's also vitamin K2, essential for bone health. It guides calcium to bones rather than soft tissues. Now, let's discuss DEXA scans. They've become symbols of the perimenopause wellness trend. So who needs one? The U.S. Preventive Services Task Force has new guidelines. All women 65 and older should get routine scans. Postmenopausal women under 65 should get them if risks exist. DEXA measures bone mineral density and gives a T-score. A score above 1.0 is normal, below 2.5 is osteoporosis. For those with osteopenia, medication isn't always necessary. It's often a matter of lifestyle changes and monitoring. Younger women with no risk factors don't typically need scans. That's a medical decision, not a trend. Now, what matters most? It's not just what happens at 45. It's what you did at 25 that truly counts. Peak bone mass is largely influenced by genetics and lifestyle. While you're likely past that window, your 40s still matter. Exercise and nutrition can still significantly help maintain bone density. Also, the fall, more than bone density, often leads to fractures. Improving balance and functional strength aids in prevention. So what's the balanced prescription for women in their 40s? Engage in weight-bearing exercise regularly. Aim for 150 minutes of moderate activity weekly. Include 2 or 3 sessions of resistance training. You don't have to lift heavy, just challenge your muscles. Ensure adequate protein, calcium, and vitamin D, no extreme amounts, just what is realistic. Avoid smoking and limit alcohol, as both hurt bone health. Talk to your doctor about your personal risk factors. If you're over 65, get a DEXA scan. If under 65 with risk factors, discuss it with your physician. It's important to question needs for scans, especially at a young age. So, although the chatter seems chaotic, awareness is key. For too long, women lacked information about midlife changes. Now, it's all about asking questions and taking action. This generation is building bone health their mothers weren't told about. That's a positive shift. The challenge arises when awareness turns into anxiety. Your bones need consistent, moderate attention, not panic. The science is clear and the guidelines are straightforward. Getting started is the hardest yet most important part. If this video helped you filter through the noise, share it. And follow for more content focused on actual health evidence.